Welcome back. This is Dr. DeShavo working on Chapter 9, Part 3. As always, if you have any questions, let me know. We're moving to some subjects that might seem familiar to you. We're going to be talking about hepatitis. In general, hepatitis is just an inflammation of the liver. It can be viral or non-viral. It can be acute, chronic, or fulminant. And we're going to go over all this. It can be active and not active. There's multiple causes. So it can be a virus, can be alcohol, could be medications like way too much Tylenol, could be an autoimmune disease, could be fatty liver, can promote this as well. So let's look at some non-viral. I list fatty liver there because this is becoming more of an issue as obesity rates increase. Fatty liver is fat that's deposited in the liver, and if you were to dissect that liver out and palpate it, it would actually feel slimy. And that fat starts to take over the normal functional tissue of the liver. That can eventually lead to inflammation and cirrhosis and scarring of the liver, which can lead to liver failure, liver cancer, or as I said, cirrhosis. This is not contagious. This could also be bacterial infection that's snuck in there somehow. More often we'll hear about viral, which is a contagious infection that gets into the liver, and usually this will recover in time with no residual damage, unless you're talking about the blood-borne ones, tend to have more chronic issues leading to chronic hepatitis. I have a list of all the different types in the next slide, and we'll look at that. So advancing age can increase the chance that we'll have liver damage. The liver is a tissue that is very regenerative. The thing is, it's only regenerative to a point. It will regenerate itself almost every 7 years, but if we keep abusing it, it won't keep doing that, and we can actually cause scarring in it and permanent damage. The cells that make up the liver are called hepatocytes. And so hepatic cells get destroyed when the scarring sets in and takes over the normal tissue function of those hepatocytes, and the liver loses its normal functioning. Here are the different types. So A and E are fecal oral. They're exactly as they sound. I'm sure you remember from micro, where somebody has not washed their hands and they have prepared your food and you have eaten it. It can also travel in drinking water. So fecal or rosette transmission. B, C, and D are blood or body fluid derived. These can lead to chronic infections, and you can see the list down below of prevention that you can do in these types. What I want you to mostly remember is which are fecal oral, which are blood or body fluid derived, and which turn into chronic, which is your B, C, and D. So you can have acute, and there's 4 phases. We're not going to go through all those phases, but that actually is an asymptomatic incubation phase, and then 3 symptomatic phases that you can move through. Hopefully it's caught in time to prevent it from continuing as a problem. And then chronic is hepatic disease longer than 6 months. Symptoms just vary from person to person, and you can deteriorate and the liver can decline, and we know the liver does so much work for us. But they have really good medications that you could take now that can help with these chronic forms. So fulminant hepatitis is uncommon. This will progress quickly and can lead to liver failure, hepatic encephalopathy, which would be infection that would go up to the brain, or death within 3 weeks. So this would be obviously an acute issue that would need to be taken care of quickly to prevent it from continuing and causing decline and death. Little quick question for you. The types of hepatitis spread by blood or bodily fluids would be A, hepatitis A, B, hepatitis B, C, hepatitis E, or D, none of the above. Go ahead and answer that. Pause if you must, and we will move on to cirrhosis. So Cirrhosis is basically when liver damage becomes so progressed that it becomes scarred, and normal liver tissue is replaced by connective scar tissue. There is usually an interim stage of a fatty liver, which will then progress to the scar tissue. So hepatitis can lead to cirrhosis. Hepatitis C and chronic alcohol abuse are actually the most frequent causes of that cirrhosis. Cirrhosis can manifest as portal hypertension. I'm going to show you in the next slide a picture of the portal system for the liver, and I'll explain to you how portal hypertension manifests. Well, as a matter of fact, let's go to that and come back to this slide because I think it'll be helpful in understanding the other conditions that are on the previous slide. So the hepatic portal circulation, I'm just enlarging that. The hepatic portal circulation will bring nutrients and water from the intestines and the colon. So you can see the colons here. I think they've taken out the small intestines, but there's also blood vessels that go to the small intestines. And these blood vessels all come together from the large and the small intestines, and also from the spleen and the pancreas. And they send nutrient-rich blood to the liver. So this vessel is called the portal vein. And the entire portal circulations, all those blood vessels that come from the intestines and the spleen and the stomach, and dump all that nutrient-rich blood into the liver. This is the hepatic portal circulation. When the liver gets scarred and damaged with cirrhosis. Hate it when it does that. Apologize. There we go. When it gets damaged, you cannot get this nutrient-rich blood in from the hepatic portal circulation. And what will happen is it backs up into these veins. And these veins will actually leak some of it out into the abdominal tissues. And these veins will distend actually around the umbilicus. And it'll push fluid back into the esophagus, and you'll get varices. So when the cirrhosis happens, it'll block the blood from getting out of that hepatic vein into the liver to be processed. It'll back up into the abdomen and the surrounding veins. So that'll lead, if we go back one slide, to potentially jaundice, because we can't filter the blood out of the liver, and we can't filter the substances out of the blood, I should say, to clear the blood out of all the byproducts from the breakdown of red blood cells, and we can get jaundice. We could get ascites, which would be distension of fluid into the abdomen. That happens because of the backup of the blood into the portal system. The spleen can get enlarged. That's usually a cofactor when we have cirrhosis of the liver, because once again, blood drains from the spleen to go into the hepatic portal vein. It'll back up to the spleen and distend it. You could get varicosities in the esophagus and the abdomen, and you could get portal hypertension, because once again, the blood can't get out of that portal vein. It backs up into the portal vein, and it increases the pressure in the portal vein. I hope that makes sense. That's a chunk of change. If it doesn't, send me an email after you rewatch this once or twice. So here is a nice, healthy, normal liver. And this looks just like the liver, I'm sorry to say, but that you would cook if you bought it, like a cow's liver, right? It looks fresh and red and healthy. Here is the liver with cirrhosis, and you could see the damage to it. You could see the fat. See the yellow spots located there? That's the example of fat that we find in the liver that can be transformed into the connective scar tissue that happens with cirrhosis. Here's the development of the esophageal varices. I don't think this is super clear, this picture. This is why I got a different picture for the hepatic vein that I showed you, portal circulation. But you could sort of see, Okay, so these esophageal veins will drain into this portal system as well. So if the portal system is backing up, it can back up into these esophageal veins. They will distend, and that's when you can get blood in your vomit when you are breaking open these esophageal veins, and you get those varices that are distended and they can actually break open. All right, moving on to pancreatitis. Pretty straightforward. Inflammation of the pancreas, which could be acute or chronic. It could be from alcohol abuse. It can be from cholelithiasis. It could be from excessive medicine abuse. It sometimes can just happen. And, excuse me, with injury with the pancreas, whether it's a byproduct of direct trauma or there's alcohol abuse causing damage to the tissue and inflammation, excuse me, if there is cancer, whatever it may be, don't forget that in the pancreas we have cells that contain digestive enzymes. These enzymes are kept inactive until they are released from the cells. So with pancreatitis or injury to the pancreas, we can release those enzymes. It'll leak into the pancreatic tissue and or the surrounding tissue and start to eat away at those tissues. So that's an important physiological thing that you need to remember. This can lead to edema, bleeding, damage, and death of that tissue. So the pancreatic tissue, once it's damaged and dies, can actually be replaced by fibrotic tissue. And this will decrease the effectiveness of the pancreas with digestion and also with the islets of Langerhans, which deal with the balance of insulin in the bloodstream and also glucagon. We'll get into that in the next chapter. One more little side note. This is why pancreatic cancer is so devastating, because the pancreatic cancer starts to eat away at the pancreatic cells, opening up those enzymes. They leak into the surrounding tissue, break that tissue apart, send out more enzymes, and the cancer can actually escape out. So this is why pancreatic cancer is so just devastating to a patient. Diarrhea versus constipation is a very simple concept. The large intestine is what reabsorbs water to be put back into our bloodstream. Okay, so the large intestines is the area that will reabsorb water from whatever foodstuffs is in the GI tract to go back into our system. Diarrhea happens when feces simply moves too quickly through the GI tract and water is not absorbed. This happens when our medulla senses that we have something that shouldn't be in our foodstuffs, bacteria, viruses, food poisoning, and it will increase motility of the GI tract and push the feces through, and you get diarrhea. Constipation is when feces moves too slowly, and a lot of water is reabsorbed in the large intestines, and the feces gets hard and dry. Easy peasy. Not so easy. Intestinal obstructions. The concept is easy. It's got to be horrible for a patient. So this is when you have blocked intestinal contents from a multitude of issues. Electrolytes and proteins will increase, causing abdominal distension and pain because we're not getting rid of all those byproducts, and it backs up in the system. Intestinal blood flow can become impaired. This can actually lead to necrosis of the tissue in the GI tract because it's not getting its own blood flow. That's kind of a concept we should talk about very briefly, which you probably already understand, but all of our organs also need their own blood supply so the tissues can regenerate and be healthy. So when the intestines get blocked, there's a huge blood supply to all the intestines, and that gets cut off. That can lead to death of that tissue. So we can have perforation, which can open up the intestines, which is very bad. In the intestines, we have hundreds of bacteria that are used to process foodstuffs. If those get out into the peritoneal cavity, we can cause infection that is very difficult to treat. pH imbalances, fluid disturbances, shock, and death. So abdominal distension and cramping, and obviously if they're not passing feces, would be all manifestations of obstruction. So it can be mechanical, such as a foreign body, a tumor, adhesions. If people have a lot of, some people tend to develop more scar tissues, like people who form keloids. They could, I'm not saying people with keloids, but some people can form adhesions in different areas of their bodies. Endometriosis would be another example. You can also have diverticulitis. This can lead to obstruction as well. So paralytic ileus is going to be paralysis of those intestinal muscles leading to an obstruction. So for some reason, the innervation going to those intestinal muscles has been damaged. Low back issue, nerve infection, whatever it may be, and you get paralysis of the intestinal muscles, which would stop movement of feces through, and it would get blocked. Here's examples of things that can lead to it. Once again, I'll stick with my notes, but what I liked about this is it shows you the diverticulum filled with feces, which can lead to inflammation, which can cause an obstruction in that area. And that's why people with diverticulitis can get intermittent constipation with diarrhea, because the inflammation will go down a little bit, diarrhea will pass through, it'll go up a little bit, causing obstruction, and it can be intermittent between them. And as I said, the ones that I didn't mention in the previous notes that are on the left there, I won't mention on an exam. Here we go with another question time. How fast or slow things move through the stomach will determine whether a patient has diarrhea or constipation. So read that carefully. True or false? All right, let's look at appendicitis. So bread and butter stuff. This is inflammation of the vermiform appendix. Vermiform actually means worm. It looks like a little worm. If I were to dissect an appendix out, it looks almost like a little worm. It always reminds me of my pinky. It's about that length, about that size, and it's obviously softer than your pinky because there's no bones in it. It gets infected because feces actually can get trapped in it. It has an opening into the large intestine. If feces were to actually get stuck in that opening, it could get infected, lead to swelling as it is obstructed. Microorganisms will proliferate in there. It'll fill eventually with exudate, and blood vessels can become compressed. Ischemia, which is lack of blood supply, can happen because it's swollen. It'll compress the surrounding blood vessels, which can lead to death of that tissue. That pressure can escalate until it gets to the point where it can open up and break open, leading to peritonitis, which is very bad as well. I'm sure you guys know all about this. Peritonitis can spread that infection throughout the abdomen, which can lead to tissue death and also death itself because the infection has spread so much. So manifestations can be asymptomatic to sudden and severe. Can start as pain anywhere in the abdomen. Quite often it'll go to that right lower quadrant, halfway along the ligament, okay, in the abdomen, and that is McBurney's point, the inguinal ligament. Indications of peritonitis may be signs and symptoms of this as well, and this is an urgent diagnosis and treatment. Peritonitis is inflammation of the peritoneum, which is all those abdominal organs that I spoke about before that are in those serous membranes. This can be a chemical irritation such as a ruptured gallbladder, ruptured appendicitis or spleen, or you could have some sort of organism invasion, such as from, appendicitis. Why do they have those all separate? Interesting. I am just going to take this out. Causes. We're just going to say ruptured gallbladder, spleen. I don't quite agree with how they have this organized. Okay, so ruptured gallbladder or spleen or appendicitis. Okay, could also be some sort of trauma if somebody has been stabbed, for example. Okay, so several protective mechanisms are activated, and exudate will bond to nearby structures, trying to seal them off. You can also get a more formed abscess. Peristalsis will slow down in response to that inflammation, trying to decrease the spread of those toxins and bacteria. Usually this will be sudden and severe. It'll have abdominal rigidity, tenderness, and pain. Oh, and don't forget with appendicitis, you can have that rebound pain where you push in and you pull out. And this would be true of peritonitis, I'm sure, as well. And they have pain upon the rebound when you pull your hand away. If you don't know that already, you can look up rebound tenderness. I won't test you on it. I'm just thinking clinically it would be a good thing for you to know. So large volumes of fluid can leak into the peritoneal cavity, causing distension and swelling. Obviously, this patient would probably also be nauseous and vomiting. Celiac disease is usually an inherited autoimmune disorder where they start to not be able to absorb substances. And this is a result... All right, I'm back. Sorry about that little pause there. My dog started barking, so I had to pause the tape for a minute. So, celiac disease results from usually an immune response and environmental issues. There can also be genetic predisposition. Now, what happens is their intestinal enzymes prevent them from digesting, breaking down, and absorbing gluten. And gluten is in many grains. So what happens is the lining of the intestines actually have little bumps on it, little wave-like structures called villi. And they look like this. And they're not quite microscopic, but almost. And what those do is increase surface area. And the increase in surface area allows our foodstuffs to get more enzymes that we release to break down foodstuffs, and it also allows us to absorb more. Anytime you see that wave-like pattern, it's increasing surface area for more absorption. Well, people with celiac disease, those villi get destroyed. So they are not able to absorb substances as well and or release the enzymes that they need to break down foodstuffs to be absorbed. So the signs and symptoms of this is the inability to absorb nutrients, growth and developmental delays, hair loss, hypoglycemia, vitamin mineral deficiency, anemia, dental defects, anything you could think of that would decrease their ability to absorb substances. So it manifests usually with abdominal pain and distension, bloating, gas. They lose weight, they're not flourishing, they're not growing. And the treatment for this, I know quite often I don't talk about the treatments, but is a no gluten diet for these people. All right, we're going to do question time, then take a little break. Abdominal distension and discomfort can be a sign of A, peritonitis, B, appendicitis, C, celiac disease, D, all of the above. I thank you very much. And if you have any questions, please let me know. Otherwise, I'll see you in the next video.